Hello and welcome to our special show tracking COVID-19. I'm Abhishek Mahajan, and in the next half an hour we will get you all the updates on COVID-19. We'll tell you what Health Minister Dr. Harshvardhan said, and Civil Aviation Minister too did a press conference today and said that the domestic flights will resume from 25th. We'll give you the global updates too, and also why World Health Organization WHO is a little worried. First up, the headlines. The overall number of global coronavirus cases crossed 50 lakh mark. The death toll increases to over 3.28 lakh. $45,299 patients cured of COVID-19 in India. Recovery rate is improving continuously and is 40.32% presently. India currently has 63,624 active cases. Heavy bookings on for train services starting from 1st June. These special services shall be in addition to the existing Shramik special trains and special AC trains. Domestic civil aviation operations to recommence in a calibrated manner from May 25th. Government issues new guidelines. Civil Aviation Minister Hardeep Puri says airlines to adhere to lower and upper limit of fare prescribed during pandemic period. Indian nationals continue to be brought back under second phase of Vande Bharat mission. 1,500 Indians returned from Saudi Arabia, UAE, Oman, Kuwait and Qatar on 9 special flights yesterday. Flight from Sydney takes off to bring stranded Indians back. So let's start with an update on the number of cases of coronavirus. A total of 45,299 patients have been cured of COVID-19 in India. A total of 3,002 COVID-19 patients are reported cured since last 24 hours. We are talking about the recovery rate is improving continuously and is 40.32% presently, which is a very positive news. And India currently has 63,624 active cases, and these are all under active medical supervision. And of the active cases, only approximately 2.94% of the cases are in ICU. The case mortality rate in India is 3.06%, which is much lesser in comparison to the global case mortality rate of 6.65%. So this brings into focus our efforts towards timely case identification and proper clinical management of the cases. So an analysis of the deaths indicates 64% deaths in males and 36% in females. In terms of age distribution, it is observed that 0.5% deaths are reported in less than 15 years of age group, 2.5% in 15 to 30 years age group, and 11.4% in 30 to 45 years age group, and 35.1% in 45 to 60 years age group, and 50.5% in people above the age of 60 years. And further, 73% of the death cases had underlying comorbidities, and elderly people above the age of 60 years and people having comorbidities are identified as high risk groups for COVID-19. And it is advised that community awareness on COVID appropriate behavior is an important intervention for prevention for spread of this disease, and there is a need to focus on personal hygiene, hand hygiene and respiratory etiquettes and environmental sanitation. Face covers and masks should be used in public places and physical distancing should be followed, and large gatherings should be avoided, and individuals in high risk groups should stay at home except for essential and health purposes. Moving on, Union Health Minister Dr. Harshvardhan has said that 1 crore people have been benefited from Ayushman Bharat Yojana so far, and 14,000 crore rupees have been spent on it. He added that over 12 to 13 crore Ayushman Bharat cards have already been issued.
1 करोड़ गरीब लोग अब तक लाभार्थी बन चुके हैं। इनको अनेक प्रकार के माध्यमों से हम लोग सूचना दे चुके हैं। जैसा बताया गया कि शायद 14,000 करोड़ रुपए के लगभग का लाभ इन गरीब लोगों को मिल चुका है और शायद 12-13 करोड़ लोगों के हम कार्ड बना चुके हैं। लेकिन मुझे लगता है कि अभी इस दिशा के अंदर हमको इस यात्रा को और तेजी से सफर को तय करना है।
Right, and starting Monday, that is 25th of May, domestic civil aviation operations will commence but in a calibrated manner. Civil Aviation Minister Hardeep Singh Puri said that for operation from metro to metro cities, 1/3 capacity of approved summer schedule 2020, which is more than 33.33%, and for operation from metro to non-metro cities and vice versa, where weekly departures are greater than 100, 1/3 capacity of approved summer schedule 2020.
The domestic civil aviation operations will be permitted with effect from 25th May to a limited extent of the required and approved capacity of the summer schedule 2020 for operations from metro to metro cities. 1/3 capacity of the approved summer schedule 2020 for operations from metro to non-metro cities and vice versa, where the weekly departures are greater than 100, 1/3 of the capacity of the approved summer schedule 2020. For operations from metro to non-metro cities and vice versa, where the weekly departures are less than 100, airlines are free to operate any routes of the 1/3 capacity of the approved summer schedule 2020.
Right, he also said that a self-declaration or Arogya Setu app status on a compatible device will be obtained to ensure that a passenger is free of COVID-19 symptoms. He said that passenger with a red status on Arogya Setu app will not be allowed to travel.
Hawai Adde pe there will be no physical check-in, only a web check-in will be allowed. A self-declaration or Arogya Setu app status on a compatible device would also be obtained that the passenger is free of COVID-19 symptoms. Passengers jinka red status ho is app pe, they will not be allowed to travel. Passengers will be required to wear protective gear, face mask, and to carry sanitizer bottles. Airlines shall not provide meal services on board. Water bottles will be made available in the gallery area or on the seats.
And also the Civil Aviation Minister said that the lockdown was effective and death rate in India is slow and recovery rate is high.
Lockdown was effective because it was taken early and in a timely manner. We can today say with a great deal of confidence that we have been able to escape the situation which other countries found themselves in. I mean, for a country of India's size, 1.35 billion people, we are testing what, 100,000 people a day? More than that. And the total number of fatalities is about 3,000 or so. Our recovery rate is doing very well.
And also government has set a minimum and a maximum fare for domestic flights. In the case of Delhi, Mumbai, the minimum fare will be 3,500 rupees for a journey between 90 to 120 minutes, and a maximum fare will be 10,000 rupees. And this is operative for 3 months till 1 minute to midnight on 24th August. And Civil Aviation Secretary said that 40% of seats have to be sold at a fare less than the midpoint of the band.
Categorized all the routes into 7 different categories: A, B, C, D, E, F, G, and each is on an increment of 30 minutes of flying time. So for an example, if we take Delhi Mumbai, now this is the densest route we have in the country, and Delhi Mumbai happens to be the densest route maybe perhaps in the world also. Now in this, the lowest fare which has been prescribed is 3,500 and the upper limit is fixed at 10,000 rupees. 40% of the seats have to be sold at a fare less than the midpoint of the band.
And also this is important to mention that the Railways has decided to further restore passenger train services from 1st June for transporting people across India, and the Railways will start operations of 200 passenger services. So bookings of all these trains commenced today from 10 a.m. on IRCTC website and through mobile app. These will be fully reserved trains having both AC and non-AC classes. And general coaches shall also have reserved seat for sitting. There will be no unreserved coach in the train. And all quotas shall be permitted in these special trains as has been permitted in regular trains. However, only 4 categories of Divyangjan concession and 11 categories of patient concessions are permitted in these special trains. So all passengers shall be compulsorily screened and only asymptomatic passengers are allowed to enter or board the train, and also all passengers must wear face mask, cover at the entry and during travel, and no linen blankets and curtains shall be provided inside the train. And also all passengers must download and use the Arogya Setu mobile applications. These special services shall be in addition to the existing Shramik special trains being run.
जो कॉमन सर्विस सेंटर्स हैं, कल तक हम उन सब में भी बुकिंग शुरू कर देंगे। एक 2-3 दिन बाद जो काउंटर्स हैं, अलग अलग स्टेशन, मेन स्टेशंस पे काउंटर्स भी शुरू करेंगे। किन किन स्टेशनों में ये काउंटर बुकिंग की सुविधा दे सकते हैं, ये अभी स्टडी हो रहा है पूरे विभाग में। 200 नॉन एसी ट्रेन की सूची कल जारी कर दी गई है। उसकी बुकिंग आज सुबह 10 बजे से प्रोग्रेसिवली बढ़ाते जा रहे हैं। अब लगभग 75 ट्रेनों की बुकिंग शुरू हो गई है और ट्रेनें जोड़ते जाएंगे। अगले चरण में जो कॉमन सर्विस सेंटर्स हैं, कल तक हम उन सब में भी बुकिंग शुरू कर देंगे। एक 2-3 दिन बाद जो काउंटर्स हैं, अलग अलग स्टेशन, मेन स्टेशन पे काउंटर्स भी शुरू करेंगे। किन किन स्टेशनों में ये काउंटर बुकिंग की सुविधा दे सकते हैं, ये अभी स्टडी हो रहा है पूरे विभाग में।
Also, to give a brief of what Union Railway Minister Piyush Goyal said, that a counter booking will also start in 2-3 days time. But now let's have a look at some international news. Here's a graphical representation of the COVID-19 outbreak in different countries. Right, so US is still #1 in terms of number of active cases and also in death toll. Moving further, European Union tourism ministers met on Wednesday via video conference to discuss how to kickstart Europe's embattled tourism industry. Lucy Howe gets us the detailed report.
Well, Germany's Foreign Minister Heiko Maas met with his EU counterparts on Monday to discuss what summer holidays might look like for EU travellers and those from further afield. Essentially, whilst some borders will reopen, it will not be business as usual. Things like face masks on planes or strict social distancing in restaurants, as well as on beaches. In hotels, sun lounges by the pool will be drilled to the ground to ensure that people maintain a safe distance from each other. Meanwhile, there's been the announcement of a major EU recovery fund announced by the leaders of France and Germany, Emmanuel Macron and Angela Merkel. This is some €500 billion that will be put towards funding countries who've been badly hit by the virus, like Italy and Spain, as well as the hardest hit sectors. Significantly, this would be issued as grants, not loans, which is something long called for by those countries in the south of the bloc. But it's already being met with opposition by countries in the north of the bloc with more robust economies like Austria, Denmark and Finland. They say they are opposed to the idea of the money being issued as grants and that the money should instead be issued from an EU-based loan from which countries like Italy and Spain can borrow. We do see another row over EU solidarity between north and south on the horizon. Lucy Hoff, Dordashen News, Brussels.
And also, Russia's Prime Minister says the country's outbreak appears to be stabilizing gradually, as for the first time there are more people being discharged from hospital than new active cases. Lucy Taylor reports from Moscow.
Russia's Prime Minister Mikhail Mishustin is back at work this week after suffering from coronavirus himself, and he said the picture across Russia is similarly slightly improved. He said the latest figures suggest that the outbreak is stabilising across the country and particularly in Moscow. Moscow has been the hardest hit region of Russia with about half of all confirmed infections. But Moscow's mayor had a warning. He said that mortality in May is likely to be higher than it was in April because we're beginning to see the deaths of those who've been in hospital for several weeks since the outbreak was at its height. The number of cases, though, the number of new infections each day is falling both across the country and here in Moscow. And the World Health Organization has agreed that it appears the outbreak here is stabilising. Moscow's mayor said that the city had avoided the worst case scenario of a peak that would overwhelm hospitals. It seems now that more people are being discharged from hospital than there are new cases each day. He said, though, that the situation was still far from ideal and that it will be several weeks before he's willing to consider relaxing restrictions further. Lucy Taylor in Moscow.
So Nepal has reported third death due to COVID-19. According to the Ministry of Health and Population, a 41-year-old man died of coronavirus in Rupandehi district today. Meanwhile, 9 more persons tested positive this afternoon, taking total number to 453. Earlier in the morning, 17 people were diagnosed with COVID-19 and there are now 401 people having coronavirus in Nepal, while 49 people have been recovered. 3 persons lost their lives due to COVID-19 so far, and currently 25,030 people are kept in quarantine in the Himalayan nation. And the World Health Organization has expressed concern over the rising number of new coronavirus cases in poor countries, even as many rich nations emerge from the lockdown. And head of the WHO's emergency program, Dr. Mike Ryan, has urged people to avoid using the malaria medicine hydroxychloroquine except for conditions it is proven to treat.
Every sovereign nation, particularly those with effective regulatory authorities, is in a position to advise its own citizens regarding the use of any drug. However, from the hydroxychloroquine and chloroquine are already licensed products with indications for many diseases. I would point out, however, that at this stage, hydroxychloroquine, norchloroquine have been as yet found to be effective in the treatment of COVID-19 or in the prophylaxis against coming down with the disease. In fact, the opposite in that warnings have been issued by many authorities regarding the potential side effects of the drug.
Also, WHO chief, while reacting on the letter received by the US, said that they have received the letter and they are looking into it.
On the letter, we have, of course, received the letter and we're looking into it.
Now let's see what's happening around the world. Let's start with Russia. Russia's official coronavirus death toll rose to 3,099 today after officials said 127 people had died in the last 24 hours. Moscow confirmed 2,913 new cases and 86 deaths. Russia's authorities reported 8,849 new cases of the novel coronavirus, pushing the nationwide case tally to 3,17,554. The Russian capital accounts for almost half of them. China today said Mike Pompeo's lies bankrupted his credibility in the world and urged him to explain shortcomings in the U.S. response to the virus. U.S. Secretary of State Mike Pompeo took fresh aim at China over the coronavirus on Wednesday, calling the $2 billion Beijing has pledged to fight the pandemic paltry compared to the hundreds of thousands of lives lost and trillions of dollars of damage. China's top political advisory body started its annual session today afternoon in Beijing. Xi Jinping and other Chinese leaders attended the opening meeting of the third session of the 13th National Committee of the Chinese People's Political Consultative Conference held at the Great Hall of the People. All attendees of the meeting paid a silent tribute to martyrs who died fighting COVID-19 and compatriots who lost their lives in the pandemic. At the meeting, the agenda for the session was reviewed and approved. With lockdown restrictions being gradually lifted, Italy has left the worst part of the COVID-19 emergency behind, but it is not party time yet. Prime Minister Conte warned on Thursday, making an appeal to his fellow citizens, especially young Italians. Conte said that in this phase, more than ever, even when we are outdoors, we must respect safety distances and where needed, wearing protective masks remains essential. Japanese Prime Minister Shinzo Abe's recent pledge to build 2,000 new ventilators for coronavirus patients has become a burden on some small ventilator makers that only produce more than a few dozen a month. Sanko Manufacturing, a ventilator maker based in Saitama Prefecture, is making coronavirus ventilators with parts from human anesthesia machines and ventilators designed for cats and dogs. It usually builds around 30 ventilators a year and initially proposed to build 300. It later scaled that back to 50 as the firm faced difficulties in procurement of parts. Abe said in April that Japan is broadly planning to get 15,000 new ventilators and later requested Japanese companies to build 2,000 ventilators to add to a stock of 4,700 already in hospital storerooms. A further 8,300 are deployed in critical care units, of which only a fraction are used to keep COVID patients alive. Japanese Prime Minister Shinzo Abe announced today that he was lifting the state of emergency in Osaka, Kyoto and Hyogo Prefecture following a drop in the number of infections. Abe said that Tokyo and 3 other prefectures, including the northern island of Hokkaido, will stay under restrictions for now, but he may lift the state of emergency in Tokyo as early as next week if new coronavirus infections remain low. Osaka has recently seen no new cases, while 11 new infections were confirmed in Tokyo on Thursday. Unlike many other countries, Japan has not suffered an explosive surge in infections with 16,433 confirmed cases, including 784 deaths as of today morning, according to public broadcaster NHK. Bars and pubs opened in New Zealand for the first time in months today as restrictions to limit the spread of the coronavirus were eased further and the government looked to revive economic activity. Venues serving alcohol have remained closed across the country despite most other businesses reopening last week. New Zealand enforced some of the tightest social restrictions in the world to stop the spread of the coronavirus. The measures helped limit infections to just over 1,500 people and 21 deaths, far fewer than many other countries. Chile surpassed 53,000 confirmed cases of the coronavirus on Wednesday, with the virus registering a rapid advance in recent days after it spread from more affluent areas of the country to crowded, poorer areas. The number of deaths from COVID-19 rose to 544, the Health Ministry reported in a press conference, while the total number of confirmed cases was 53,617. The world's largest copper producer has seen an increase of 10,000 cases in the last 4 days. Britain's system for tracing those with the novel coronavirus was under fire as it grappled with the development of a tracking app, and health workers warned the government that unless there was clarity, it could suffer a second deadly wave. Prime Minister Boris Johnson on Wednesday had said that a world-beating program to test and trace those suspected of having been in contact with people who have tested positive for COVID-19 would be in place by June 1st. Britain is currently testing the app based on Bluetooth on the Isle of Wight off the southern coast of England, where the government says more than half the residents had downloaded it, but Britain's system has been dogged by criticism. Opposition lawmakers said an earlier promise of a nationwide rollout of a national health service, which is NHS developed smartphone app, had slipped from the middle of this month. The NHS Confederation said the United Kingdom is at risk of a second jump in cases without clarity on government strategy. And with this, we come to the end of the show. We leave you with this beautiful song written and composed by two extremely talented brothers, Samyak and Suramya, signifying the importance of Arogya Setu app and Atmanirbhar Bharat. Namaskar.
ये नज़ारा है एम्स जोधपुर का, जहां बीएसएफ के 42 कोरोना पॉजिटिव जवान अपनी मजबूत इच्छा शक्ति और बेहतर इलाज के बाद ठीक होकर अपने अपने घर लौट रहे हैं।
आप लोग देख सकते हैं ये करीब
खुशियों के पल हैं सीएपीएफ रेफरल हॉस्पिटल ग्रेटर नोएडा के, जहां आईटीबीपी और बीएसएफ के 20 कोरोना पॉजिटिव जवान अब पूरी तरह से ठीक होकर घर लौट रहे हैं।